Sure, Tom.
Thank you all for joining us this afternoon. My name is Kathy Roth-Duquet, and I'm CEO and co-founder of Blue Star Families. Blue Star Families is a national nonprofit dedicated to supporting active duty, National Guard, and reserves, veterans, and their families from all ranks and services. We work to support military families while strengthening communities. I'm joined here today by Matt Boren, the Executive Director of ADC. Welcome, Matt.
Hi, Kathy.
Hey, would you like to kick things off to tell folks a little bit about ADC and CMSI?
Yeah, absolutely. So for over 40 years, the Association of Defense Communities has been supporting the resilience of communities, states that support America's military. Nearly 300 community states, regions, and affiliated industry partners, ADC represents every major defense community and state in the nation. The COVID-19 Military Support Initiative will provide resources and expertise to support community, states, and military families throughout this crisis, including hosting events like today. We also have a daily newsletter and a robust website that includes links to important resources, as well as recordings of past webinar events. The important work of this initiative would not be possible without the generous support of our sponsors. This initiative is powered by Booz Allen Hamilton, with significant support from USAA. I also want to recognize the Bristol Myers Squibb Foundation, the Association of Military Banks, the Military Housing Association, Hunt Companies, J.P. Morgan Chase and Company, and First Command Financial for their contributions. One of the important goals of the COVID-19 Military Support Initiative is to bring together groups from across the military community, local and state government, and industry to build collaboration that helps our families and communities. I'd like to specifically thank a group of organizations that are supporting this effort through the White Oak Collaboration, as well as all of the national, state, and local level governments and defense community advocacy organizations who are making this initiative possible. All of our partners are instrumental in providing the resources we share for military families and bringing together many of our town hall participants and subject matter experts. Kathy, back to you.
Thanks, Matt. I also want to thank Mrs. Holly Ann Milley for joining us today. Thanks for being here, Holly Ann. Holly Ann will be speaking in a few moments, but first I wanted to share the results of week 4 of our Paint Point poll. So if I could share those, particularly as the results correspond to our topic today. As of this week, we've had nearly 4,000 respondents. Nearly 80% are from active duty families, 18% from veteran families, 6% National Guard and Reserve families, 16% civilian. We analyzed the civilians separately. Please share the poll with your networks. Thank you to Holly Ann and the other senior spouses who've been sharing. The more results, the better. We particularly need more National Guard and Reserve families to understand how those folks are doing. Next slide, please. You can see here that we're comparing families from different communities to see how they're doing, but on a scale from 1 to 5, 5 doing very well, 1 doing very poorly. And we're seeing a little bit more challenge among National Guard and Reserve families compared to others. So that's one piece we want to dig into further. A lot of people are right in the middle. So it's a lot for us to keep track of. We'll keep watching this over coming weeks. If I could have the next slide. Pain points related to spouse employment, mental health, and children's education are becoming a little more acute. These issues are intersectional and shouldn't be viewed in isolation. So 9% of our military family respondents are now seeking unemployment benefits. It's important to note that that's on top of the 24% unemployment that military spouses normally have. So that's a bit of a difference with the population at large. In terms of mental health, we're starting to see 50% of mental health family respondents saying that they're doing worse today than they were doing 2 to 4 weeks ago. So again, we want to be tracking these over time and recognizing that people need to take positive actions for their mental health. That's today's panel. Children's education, more schools are announcing closure. There's an intersectionality between family well-being and mental health. So this is something we'll be tracking. Military families are trying to take care of their own mental health, but respondents without prior mental health diagnoses are starting to experience symptoms. We're seeing 45% of military families proactively taking care of their health, compared to only 33% of their non-active duty counterparts. So that's a good sign. Our community is being proactive in taking care of them. However, that still means that over half of us aren't, and that's an area for us to try to improve. Only 28% say that their mental health has not been impacting. Next slide, please. Great. Please look to our website to see more in-depth information about this poll as it pertains to mental health and other issues. Now I'd like to get on to the panel. First, how to ask questions. We know many of you have questions pertaining to the psychological impact of COVID-19. If you have a question, please submit it through the chat page on our forum. The panelists will answer as many as possible. Those we don't get to, we will answer on our website, so check in there. Now, finally, I get to introduce Mrs. Holly Ann Milley. She's a great friend and a great military advocate. Mrs. Holly Ann Milley is the spouse of General Mark Milley, chairman of the Joint Chiefs of Staff. Mrs. Milley has been a nurse for 32 years, spending 18 years as a critical care nurse. So I know this pandemic is hitting home to her on her professional side as well as her military side. Mrs. Milley serves as an advisor to many nonprofit organizations, including the Red Cross, the USO, Army Emergency Relief, as well as many others, all of which have been impacted in this outbreak and are participating in this collaboration. Please join me in welcoming Mrs. Holly Ann Milley. Holly Ann?
Hi, Kathy. Hello, everyone. Thank you for joining us all today. And Kathy, thank you for that warm introduction and for allowing me to share one of our stories with you all. So in 1989, our first child was born at Fort Ord in Monterey, California, and we were so thrilled to be bringing our beautiful baby girl home. And as many of you know, bringing your first child home is both wonderful, but it can be stressful as well. We were excited about every facial expression, every little sound she made, while still trying to adjust to the lack of sleep, many feedings, and many, many diaper changes. And like many of you, our families were 3 time zones away, but we were working hard to create a wonderful home for our new family. About 3 weeks after she was born, it was a typical sunny California day, and Mark was headed off to work, and we were settling into our new routine. At around 5 o'clock that evening, I sat down to feed her and decided to call my mother in Georgia. Shortly after she answered, the ground started to shake. And living in California for a few years by then, you learn quickly that you may feel an earthquake or two, but it was never, ever anything like I was experiencing at that moment. The china cabinet fell to the ground, dishes crashing everywhere, bookcases, pictures off the wall, and I was moving as quickly as I could to get the 2 of us under the dining room table, which was the quickest place that we could get to for cover. All while my mother was listening on the phone to the screaming and the commotion and the crashing of things, and then the line went dead. Amazingly, our daughter managed to sleep through the entire earthquake. So at the time, that was one of the largest earthquakes, most powerful and destructive earthquakes to hit a populated area in the United States. It was a 6.9 to 7.1 magnitude, started in the Santa Cruz Mountains, which is about an hour away from Monterey. Fortunately, we were fine and just suffered minor damage in our home. Only a few weeks later, Mark deployed for the invasion of Panama. Within a 3-month period, I had our first child, survived a major earthquake. I was now alone with a newborn, and now a deployed spouse, and I will admit this was the first time I wondered, what have I gotten myself into? Military families face many challenges: deployments during the birth of a child, graduation, or special family events, illnesses, or even death of a loved one. The impact of September 11th, which we still feel today, countless moves, children that are sad to leave their friends and struggling to fit into a new community, living hundreds, if not thousands of miles away from family, and yes, even enduring an earthquake, and today, COVID-19. The list goes on and on. Military families have faced these challenges with strength and courage. And in doing so, we may have wondered, again, what have I gotten myself into? I may not be able to see you, but I bet a few of you are nodding your heads. Military families are resilient, and these challenges can be difficult, overwhelming, and stressful. In 1989, mental health was not really discussed or accepted and not easily accessible. Fortunately, that is not the case today. Right now, you might not have a moment alone due to working from home, kids homeschooling, and heading into summer, or many other reasons. As you're dealing with COVID-19 or any other issues today, tomorrow, or in the future, you may find yourself once again wondering, what have I gotten myself into? You may feel anxious, overwhelmed, alone. And we want you to know that there are mental health professionals that you can reach out to who understand the unique challenges military families face. Today, we have the pleasure of hearing from some of these mental health professionals as they discuss the psychological effects of COVID-19 on military families. So please take care of yourselves and each other and continue to be safe. Please welcome our panel, and back to you, Kathy.
Thank you, Holly Ann, and wow, what a story. I think I will remember that always, the earthquake and the little kids under the table. But really wise and really inspiring words, and thank you for sharing that. It means so much. I'd now like to move to our panel discussion. The panel will be moderated by the wonderful Dr. Caitlin Thompson. Caitlin's the Vice President of Community Partnerships for the Cohen Veterans Network and a Blue Star Families Advisory Board member. We're so grateful to Caitlin's help in assembling today's panel to talk about the important topic of mental health and the psychological toll COVID-19 is having on military families. Caitlin, I will turn it over to you to introduce our panel.
Kathy, thank you so much. It's wonderful to be here, and special thanks to Mrs. Millie for that really beautiful introduction. I really want to just dive into this, but first, on behalf of the Cohen Veterans Network, we're just so happy to be talking about this. I know that we've all been thinking about this to some degree, even if we're not in a military family, and so to be able to really take some time, talk this through with some experts, and also especially to answer your questions, please send those out. We really want to help as much as we can. We're going to briefly spend the next 20 minutes or so with our panelists. Each panelist will have a few minutes to just give an introduction and to talk about their specialty and what they've been thinking about lately. Then we'll have a conversation, and following that, we'll start to take all of your questions. So get those going. I'm going to very quickly tell us who your panelists are today. First, we have Dr. Rajiv Ramchand. Dr. Ramchand is an epidemiologist who studies the prevalence, prevention, and treatment of substance use and mental health disorders, who's authored a number of books and publications on veteran and service member mental health, including The War Within on preventing military suicide and Hidden Heroes on military and veteran caregivers. He is currently the inaugural Craig Newmark Fellow at the Bob Woodruff Foundation. Next, we have Dr. Stephen Koza. Dr. Koza is a retired Army child, adolescent, and adult psychiatrist. He is a professor of psychiatry at the Uniformed Services University of the Health Sciences, where he serves as associate director for the Center for the Study of Traumatic Stress. Next, Dr. Tina Atherall is the CEO of PsychArmor, as she states, and boy, do we know, she is an invested and engaged member of this military-connected community, personally and professionally, and she's been part of this community for over 2 decades. And finally, we have Ms. Tricia Winklowski, who is a registered board-certified art therapist, who is the Senior Director of Clinical Health and Wellness at Hope for the Warriors, a national nonprofit serving post 9/11 service members, veterans and their families, and families of the fallen. I wanted to start out with Dr. Ramshan, with Rajiv. If you could just give us a little bit of a foundation about where we're starting right now. What are we seeing in terms of our psychological effects of COVID-19? And Vincent, if you could put up that first slide, that would be great, please.
Thanks so much, Caitlin. So what are we seeing now? On April 3rd, my colleagues and I at the Bob Woodruff Foundation released a report projecting the economic, social, and mental health needs of America's veterans. So this was around now close to a month ago, actually. And it was the culmination, we created it really quickly as we were watching, as everyone was, this pandemic unfold. Just started thinking to ourselves, wow, what are the second order effects going to be? So just to give you an example, if you look at the next slide, one of the things we did, oh, sorry, I just wanted, before I get there, and I really think we want to talk about the psychological effects, but I did want to put this in the context that this is happening as people are getting infected with COVID and are unfortunately dying from it. So the psychological effects are important, but we shouldn't undermine that all of the things that we're doing, our social distancing, our physical distancing, are really important for containing the spread of this disease that's already claimed nearly 42,000 lives as of this morning. So the next slide, sorry. So an example of what we did, we looked at the industries that are most likely to experience layoffs and then projected what cities and communities are most dependent on those industries, and then how many veterans live there. So these are the 15 cities that we found and that you can find in our report to be the most likely to be affected. And it gives you a sense of that nearly 500,000 veterans live in these cities. So we see these effects, and this is an example of what we did. But if you go to the next slide, when we thought about mental health, what we really thought about these cumulative factors that that a person will experience and potentially impact their mental health. The first is that, especially when we're talking about military families and veteran families, we have past trauma or mental health symptoms, and we know that as new exposures or new traumas emerge, like a pandemic that we're going through, or like losing a job, that those with pre-existing conditions, that exposure, that trauma, that distressing event might be more significant or might have an additional impact on their mental health, developing new symptoms or having symptoms worsen. We also know that just like all of us, there's anxiety about getting sick. We are careful when we go to the supermarket. We are careful when we wash our hands. We are careful with everything we're doing, and that builds up, and that's anxiety provoking. And for some, that anxiety could be potentially debilitating. Then, as we've seen the unemployment numbers rise, and I could tell you when we started this, there were when we first wrote our first draft of this, there were under 100,000 unemployment claims, and it's just skyrocketed since. So the real job loss we know is a traumatic stressor, and even anxiety about losing your job. If you don't know each morning when you wake up whether you're going to have a job, that can be anxiety provoking or depressing. And we know that that can impact someone. And then finally, as the American public, rightfully so, kept engaging in these protective measures of physical distancing, we started to worry about the impact that had on loneliness, on social isolation. And we know loneliness and social isolation can contribute to mental health conditions. So next slide. These are some of our other key findings from our report. I don't want to get into them now, but you'll see we're concerned about the mental health impacts. It's something we raised on April 3rd. Related, I think, to this panel, one of the other things we identified is that we're worried about the sustainability of a lot of our nonprofits and organizations that serve veterans. A lot of them do not have the cash reserves in the bank that are ready to sustain them over a long period of time. And their funding is also threatened and compromised. So a lot of the organizations we relied on before was something that worried us. Next slide. And that's it. So that's what we've learned so far. Cursory looks, we haven't seen, significant data in the peer-reviewed literature showing how many people are, meeting criteria for depression or whatnot. There was one study out of Wuhan that showed that among healthcare workers. But these are the things that we're concerned about. These are the theories that lead us to be concerned about mental health effects, especially for adults, whether they're military families or veterans themselves. And I think Dr. Kotza can speak to the impacts on kids more accurately.
Thank you so much, Rajiv. Yes, Dr. Kotza, please let us know now. We're really concerned about our kids, our teenagers, the wealth of experience and the history that you've had in coping with these challenges is going to be particularly important. So, Dr. Kotza.
Sure. And if I could get my first slide, please, that would be great. So it's a pleasure to be here today. Thank you. One of the things that I thought would be important as we continue our conversation about the effects of COVID-19 on military families and children is to contextualize our discussion within the science of disaster mental health. So despite the uncertainty and the chaos of what's currently going on with COVID-19, the effects that we are experiencing are not random. They are, to a certain extent, predictable. The pandemic is among a number of natural disasters that can affect the population that include things like hurricanes, tornadoes, earthquakes, many of which our country has faced. But pandemic has certain unique elements that can make it particularly challenging, and I'm going to talk about that a bit. One of them being, while all disasters can have cascading outcomes, pandemic is an evolving disaster. So we're in the midst of its effects and unsure of its ultimate course and outcome, and that makes it much more complicated. Next slide, please. So given our specific focus on psychological effects of COVID-19, it's important to think broadly. Very often we think of psychiatric disorders such as PTSD, depression, and anxiety as first order, but actually they're less likely to occur and are more common in highly exposed populations like healthcare workers, those who may have had a family member die, or those with pre-existing conditions, prior trauma and loss, as Rajiv had said, or other marginalized, socioeconomically disadvantaged groups that struggle in recovery. But rather than disorder, it may also be very helpful to think about most responses being distress reactions. And those include things like changing in sleep, decreases in a sense of security and safety, physical symptoms, irritability, and distraction. And these responses are usually time limited and associated with the disaster event from a time perspective. They're very common, and we expect them actually during a period of time. So most in the audience have probably felt this way at some point over the past few weeks. Another group of responses that are equally important are risk behaviors. They're critical to target because they can add further unnecessary risk to individuals. So these are things like increased alcohol or tobacco use or misuse of prescribed or unprescribed medications, or interpersonal violence. And one of the concerns now, because of close quarters of families, the potential of family conflict or intrafamilial violence. But the takeaway here is the vast majority of individuals, both adults and children, are likely to be resilient. We will manage the stresses and changes associated with the disaster and likely not suffer long-term effects for the most part. Next slide, please. So why do pandemics pose unique challenges? Well, fear and uncertainty, there are altered perceptions of risk. I mean, we're walking around in a very different way now than we did several weeks ago. The virus is novel, unfamiliar, and it's invisible, making it feel powerful, evil, and imperceptible. And because of these factors, it creates a sense of heightened vigilance, uncertainty, and concern. And we can wind up with more suspiciousness within the population that can cause fractures within the community, blaming, attributing responsibility that undermines rather than bolsters our community capacity. We all have a need for isolation. We've heard this term social isolation. I think we should think about physical distancing rather than social distancing with social connectedness. We do need to be far apart, but we've got to figure out how do we stay connected to each other. And there are 2 points that I really want to drive home about physical distancing that I think are problematic. One, it's caused homebound families, which creates a significant amount of togetherness, but certain families don't have multiple bedrooms and multiple bathrooms, and they're living on top of each other. It can make it a much more complicated environment for people to live in, adding conflict to the family. Also, the effect on education is important, and we saw that within the results that Kathy was reporting, that the whole shift to distance learning, and children have variability in their capacity to engage. It's certainly challenging to receive special services or for those who have difficulty with motivation, attention, or organization. But there are other associated losses besides education. So lack of involvement in extracurricular activities, social activities, sports, all of which give meaning to children's life that right now they don't have available. And then finally, shortages and scarcity. So we've had concerns about hoarding, but also real job loss, lack of access to adequate health care in certain communities, and in certain communities, food insecurity. So how does this affect military children and families? As we've heard, military families in general have tremendous strengths, a sense of community pride, unity of purpose, employment, access to healthcare largely. But they also have some additional challenges, like requirement for continued readiness. So most people are managing with the virus, but the military needs to be prepared and families need to be prepared to respond to national defense needs. In addition, National Guard families and National Guardsmen have been activated to assist with the COVID response, all of which adds additional challenges. And as was described, military families have been involved in 20 years of military combat service time, involving deployments, absences, residential moves, delays in celebrations, all of which can be challenging. And like all families, there can be certain vulnerabilities, whether it's related to finances or access to basic needs. And then I just want to close with this last slide, that as we think about solutions, one way of thinking about them is maybe to group them into buckets related to psychological first aid, which is an evidence-based or certainly evidence-informed approach to helping people in circumstances like this. So focus on safety. How not only do we keep people safe, but how do we help them feel safe? Calming, staying informed but not preoccupied, and communicating clearly with children so they understand. Efficacy, what can we do that we have the capacity to make a difference and have control over? And a great example is this town hall, but also at the individual levels and involving kids. Kids can have chores, they can do things around the house and feel a part of family. Connectedness, regardless of the physical separation. I want to put a special shout out here to teenagers, because teenagers, I think, are struggling with this. Social connectedness is such an important developmental issue, and this has been a real challenge for them. And lastly, to focus on hope and optimism, that we will get through this. We may have a few battle scars, but communities will survive and we will be strong. So thank you.
Thank you so much, Steve. This was wonderful. You know, Tina, I think that you are just such a great a bridge between what Tricia and I will briefly speak about, which are some actual resources. You, of course, are the CEO of PsychArmor, which is another fantastic resource that can be used. But what have been some of your thoughts right now in terms of going from the difficult pieces that we're talking about, the struggles that people are getting through, to that hope and to that treatment and to that care?
Thanks, Caitlin. Hi, everyone. It's definitely a pleasure to be on this call, and I wish I could see like everybody that's beyond the screen. But to bridge that, first, I'd just also like to thank Caitlin and the panelists, because as we prepared over this last week as to where we wanted to start, it was really fun to know that we all came to the table with one intentional purpose, and that was making sure that our time together was relevant and would be meaningful. And so in starting with Rajiv and Stephen is really a great place to set on what is the data and what do we know, and to think about the fact that Rajiv was able to pivot so quickly and develop this type of information that we would need in the moment, I think is part of when we think about the psychological health of our military families, shows that incredible strength to our military community, because of the fact of everything that they have just said to us, is that we know that we have strengths in all of this because we've been doing it for so long. And back to Mrs. Millie's comment, right? Like, how many people on this phone call have also been through every natural disaster because of where they've lived with their duty station, or community members that know how to respond to the families that live on the other side of their gate or in their communities because they're used to that military impacted. So one of the things that I just wanted to start off on in my viewpoint is coming from a bit of psych armor, and also looking at the panelists that are here and the incredible organizers, is that we are all connected. And so it's great that we're able to respond in a way that our community will understand us because we have been embedded for so long, which is also the beauty of psych armor, in that the education that we are providing online and the way that we've been able to look internal and pivot in a time of crisis is because of everyone who has built that organization. We have individuals that came on board to do their work because they were impacted from being clinical psychologists overseas. So anyone who knows Dr. Heidi Kraft understands the power of having that type of person in a nonprofit in this space, ready to impact families or help and assist active duty. Dr. Carrie Rogers, who's been embedded in the VA for years. All of that to say that through that education, we took a moment to really step back and listen. And that was available through this initiative. We were able to hear every week what were the pain points. Then we looked at who are our allies, everybody on this call. Caitlin, how many phone calls have we had? How many text messages? Trish and the team over at Hope. So not at all like that, not that we didn't mean to all be together, but you know, what did we hear, and how many of us were able to go internal to our own organizations and say, oh wait, we're military connected. Our civilians have been very connected to this mission for so long. So a lot of the things that we heard was that we already had what was needed. It didn't need to be built. It just needed to be repurposed for this time. Who did we need to align with and say, we did this before, but what does this look like now? So back to some of the things that Stephen said around our teenagers. Those teenagers have grown up in this for 15 years. So they're now in high school, and they're going beyond, and they've missed multiple milestones along the way, not because of this pandemic, but because of other things. So what does that mean? And who's there to help in that moment that already has systems in place, and really being able to hear that part. So some of the things that I keep saying some of the things, there's a lot of things. So I got to watch Caitlin to say time off, time to give to Tricia. But, you know, a lot of the different items that we wanted to do is repurpose some of our education and make it relevant for the time being now. So a lot around self-care we're hearing. Obviously, back to what Rajiv said around financial wellness. Well, thank goodness we had partners and supporters that knew that was already important to our military families. Now, how do we repurpose that and make it relevant for this time, telehealth and using the internet and internet essentials? The one, before I toss it off to Tricia, I think what is most inspiring in all of this, and when we do look forward, and I think the conversations Caitlin will bring forward, is that I spent a lot of time and had some great moments with Blue Star families in the way in which every year we're able to look at the military annual lifestyle survey, and they have been curating a conversation along with ADC around that social isolation that military family members have felt. So this has already been an issue, right? We've been disconnected from our communities. I'm wondering what our military family members say now that this has given them an opportunity to extend a conversation to their civilian community, saying, hey guys, I got you. We've been here. And a direct example, that's what happened when we looked internal to our psych armor team, and just our conversations on where everyone was, or how do we respond? What does this look like? came about our own team saying, we want to share our coping strategies with our community. And it was purposeful. It was very wonderful to be able to do that internally, but then it's also wonderful to share with our community members. And we're really hoping that that'll also launch everybody else out there to be able to have a conversation now with maybe individuals that they wouldn't have in a time, to your point, Stephen, where we say it's physical distancing, not necessarily social distancing. We can get online and say, oh yeah, so if anyone hasn't checked out that YouTube video, it's quite funny because we had some very creative people out there. But I am actually very inspired around this. We can use the data that we know that the colleagues have already presented. We know where we've been and how can we share that with our greater civilian community.
Thank you so much, Tina. Tricia, let's spend a few minutes talking about the amazing work that you've all been doing at Hope for the Warriors.
Thank you, Caitlin, and thanks all to the panel. I'm just really honored to be on here and beside you all. We are seeing similar things from what Rajiv and his team has been putting through in the research, what Tina's talked about and some foundational stuff that's already sort of there and been working, and from Dr. Koza as well in some of the foundational stuff that you're seeing. We're seeing the same things. Hope for the Warriors, as Caitlin presented earlier, we're a national nonprofit, but we've got grassroots and community outreach. So we've been talking with our families and getting a little bit more specific about what they're going through. So those three areas that Rajiv talked about, mental health, financial stress, social isolation, are very keen. And so three concerns that we've been hearing a lot about is, that overall worry, underlying anxiety, feelings of uncertainty for themselves, for their loved ones, and for their country and their world. So that's a heavy, heavy stuff. Those, as we've talked about with previous mental health diagnoses, are experiencing some of the elevated increased symptoms, as Dr. Koza mentioned, but we're all feeling that ramped up kind of sensations or feelings. Over and above, if we recall, the narrative over the past few years have been sort of this anxiety epidemic that we were just talking about a couple months ago before COVID. So we're all there, we're all a bit elevated. The second thing that our veterans and families are experiencing, and very obviously from this onset of COVID, is that disruption to access to services. So many lapses in care and in symptom management as well as medical management, contributing to our worries and anxieties. What if I cannot get to see my psychiatrist or therapist? What if I need to execute my crisis plan? What do I do next? So those are a lot of things that we've been talking about with our families as they're coming to sort of figure out, and cope. And then the third area, as we enter into the 6 week in general of our COVID pandemic here, is going back to this disruption of our family's established routine. And that is what we're hearing more so right now, that is becoming that bigger challenge in managing our mental health issues. So what are we doing? What are we doing about that and the resources that we have available? What we've been advising is get back to the basics. Get back to the basics. So Dr. Koza talked about resilience, and that is a lot of what we do. Getting back to the basics for us is sort of getting back to what you know and getting back to what you believe. And so this thing is rocking our world, literally. First thing we got to do is sort of get back on some solid ground and start out in what you know and what you believe. So if I can pop back up to the second slide, sorry, if you go back, are you able to go backwards on that one? We believe at Hope for the Warriors that our warriors can thrive with access to integrated services. And that's focused on individual as well as our collective well-being as military families and our military community. And we recognize that every service member and military family has their own goals and needs. And sometimes, and especially right now, ideal resources do not always exist in our communities. We strive to restore self, family, and hope through our services. We have virtual capabilities, and we work together with our partners, as Tina has talked about. So for the third slide, if you want to keep going there, these are some of the resources that we have built out at Hope for several years. One of them is our Resilient Warrior and our Resilient Family program. And these are evidence-based to support mental health. Resiliency at its very core is that ability to adapt to stressful life situations, that ability to maintain a stable, healthy level of psychological and physical functioning despite our exposure to extreme stress. So Resilient Family and Resilient Warrior courses, we adapted and worked with the Benson Henry Institute for Mind-Body Medicine, their stress management and resiliency training program. And this was adapted specifically for service members, veterans, and their families. So these courses are developed through Home Base. If you're familiar with Home Base and Massachusetts General, we work together with them to develop these two pretty cool courses. They're virtual, online, focusing on mind-body wellness. We have resilience instructors that have 20 hours of that training and coursework and have become certified through our Home Base partner. So pretty cool in the fact that we're able to offer these. We've been offering them for about 2.5 years now. And so as the COVID, as we ramped up and knowing what resources we need to do, we added on more classes and more courses. These are small group courses. They're offered virtually so that we can really start to look at those resilient skills and incorporate. Many of our families already have these skills in place. Many of our active duty members, as well as our veterans, have these skills in place. So re-engaging with those, getting back into that routine, establishing your practice again on these skill sets is very important.
Trisha, thank you so much. I'm gonna have to, we gotta leave some time for questions. So just really quickly, final thought.
Oh, no worries. Would you want me to continue or finish up? Sorry.
If you can finish up.
Sure. So on that slide, we can send that information out to everybody after the questions. We are focusing on financial wellness as well. And financial social work, we have certified financial social workers on our team. And then finally, social connectedness, extremely important for well-being. And we have lots of opportunities there through our 30 by 30 challenge. And again, all virtual and keeping us connected.
Thank you so much, Trisha. Yep, great resources. I really, so I've been getting questions fed to me, my gosh, COVID, by Kathy. And so, but before that, I really want to quickly jump to the Cohen Veterans Network, just to let you all know and make sure that you're aware of the resources that we provide and share. I'm going to go through this very quickly. If you can please put up the one slide. Thank you. So we are a network of 15 outpatient mental health clinics. We have gone completely virtual. Every one of our clinics is using telehealth right now. If you live in any of these states or some adjoining states, we will see you through telehealth. If you go to cohenveteransnetwork.org, we will be able to find you care, and we see military families, we see children, any veterans, National Guard Reserve, regardless of discharge. And if there's concern about payment or anything like that, we will work with clients on a case-by-case basis to remove any barriers to access for care. So just please contact us if you have any questions about, well, whether or not you would be able to qualify. It is most likely that you will be able to, and we'll be able to help you with that. And one of the questions that came through, I think I can speak to, is what is our organization's plan to prepare for the influx of mental health issues to come? So we know that even in the next couple of months, as time goes on, we are likely going to be getting many more people who have adapted, in big quotes, to the new normal, but are now starting to realize that they need to get the help that they need. So at Cohen Veterans Network, we have taken this completely into consideration, and we're really ensuring that we have the clinicians readily available, the case managers and others. Please contact us if you have any questions there. And then I'm going to very quickly ask Rajiv, One of the other questions that came through is, are we seeing correlations between economies that are most hard hit and areas of most stress in regards to military families?
Gosh, that's a great question. I don't think we have the answer to that yet. We're only 1 month in, so we were projecting the communities that were going to be the hardest hit. I'm not sure if we actually know what communities are going to be the hardest hit. I will say that there's a nugget here for a little bit of optimism, which is that sometimes when things happen communally, there's a buffering, and I think that was things that Tina mentioned and Trisha and Steve, that essentially if there's a mass layoff, when you experience a layoff yourself and no one else around you was laid off, that can have some pretty significant effects. But if a lot of people get laid off together, there is some evidence of a communal kind of element, that it's not as bad. You don't take it as personally. And so in some communities where there are mass, that are disproportionately affected, I don't think we should just go ahead and think, oh, these are going to be the most hard hit. They're going to have they definitely will have struggles. I don't want to diminish that. But from a mental health perspective, there could be some buffering. I don't know that there will be, but it leaves some optimism for me. But the question is a great one, and it's something that this is a dynamic and fluid situation economically and from a mental health perspective. So I think we'll just have to wait and see, and we'll have to devote research resources to look at that question.
Thank you so much. I also want to let people know that if your questions aren't answered, if you want to leave us your contact information, we'd be happy to get back to you with any of these questions. Steve, I wondered if you could speak to this question. The question is, many of these psychological impacts seem similar to deployment stresses and impacts, but are very different. For service members and families who are now in their, quote, deployment mode or mental state, what advice do you have for them and community members in how to help keep this pandemic in perspective?
Right. So one of the things I think that is different, we've got models for managing deployment. We have families are used to it. There's mentorship within families across family groups. Senior spouses have much more experience with it. Pandemic is something that's entirely new. And so we don't have the same level of experience with it. And we're all faced with the same quarter challenges about how do we deal with some things like being homebound. So what I would suggest is, if are we talking specifically about families that are deployed and are dealing with COVID, or just how to manage, how to use your deployment skills in face of COVID? Is that the question, Caitlin? So I think stresses, to the degree that we understand that stresses are similar in many ways in the way they affect us, the one way we can certainly always remember to help kids in families is that we know that children do as well as their parents do. So the degree to which we as adults can manage our own routines, be responsible in terms of how we manage ourselves, take good care of ourselves, model that for our children, communicate effectively with our children at the age that they are, I think we can better both model and help our own children become feel more comfortable and calm through something like pandemic. And I think that's all part of the deployment skills that families have.
Excellent. Similarly, Tina, I wonder if you can speak to this one. And Trisha, I think that you touched on it, and I think the work that the Hope for the Warriors is doing is also going to really help with this question. But the question is, as many memes have said online, so many elements of this pandemic have been, quote, just another day as a military spouse. We're accustomed to rolling with our new and ever-changing realities. However, I've started to notice on my base in the past week significant changes in our base family's outlook. We're just completing our 6th week under significant restrictions. PCS is postponed, denied travel requests to be with dying family members, regardless of whether it's COVID related, etc. All are starting to really impact our base families. What information do your panelists have about mental endurance for stress? What recommendations do you have to helping get over this downturn and psychological fatigue? And if I can just quickly again throw in, if you do have access to mental health care, even though this may not be a mental health diagnosis, but if you have access to mental health care like Cohen Veterans Network, like the VA if you're a veteran, and other organizations, seek out that help. It's there for you. But regardless, in other circumstances, what do you, Tina and Tricia, think?
Do you want me to go first?
Sure, please. Yeah.
Okay. Yeah. Okay. So Caitlin, I'm actually also going to just make this about you. So more of a practical answer, I guess. I mean, first and foremost with that, I just also think about military families and something, you know, I am going to make this about somewhat of my response, but then as well as just having, this is our community and what I hear and what we're, it just seems like one more thing, right? So it's not only all of these restrictions, but I've heard often from my friends like, wait, weren't we already done with that? I mean, I know somebody who's online right now that her loved one that shouldn't have deployed did, and now they have a delay of another 2 months. Like, it's those added things are like, one more thing. So in terms of the question about the long term, really those coping strategies, I'd say this is, oh my gosh, everyone needs to give themselves that space. We've said, you know, everyone has said that. And also to be able to look and go, well, thank goodness for once we're not the only ones that are going through this. Other people around us are also going through that. I mean, everyone's in the same boat now. Versus I remember at the time when leaving Camp Lejeune, I felt like the rest of the country had no idea what we were going through before. At least there's some of that similarity. Use it. I have wondered what it's like to be on the base, because I remember the base used to be so great in that we were on base. But now that I'm in a community, I love that I have my community members to reach out to. So the two lines to this is going back to what we know is that we need those people that we call in an emergency. This is a Kathy Ross Decay thing. And that's our friends. We have to have our friends. Don't forget, our friends are 100%. For that high school student that's sitting next to her mama right now, your mama is the very best thing that you need. Like, you've got what you need in that part. And then you see these people on here, you've got them. And so on that next step, when it's no longer at that place in which you can use all those tools, I hate the tools in your kit. Did we ever get rid of those? You reach out to the Cohen Center that now has, not you have to go for therapy, but you can get online and just come in for a community chat, right? Check out what the other resources are that the Bob Woodruff Foundation is starting to do in terms of elevating people who are doing work in their community. And over to Hope over here, not meaning to skip you, Stephen, but you know, looking at what they're doing in Resilient. So I think that it's at that next level after the friends in that network it has been exhausted, knowing that you have others that you can reach to, that we may not have reached to before, because then we got over the hump. So
Thank you, Tina. Yeah.
I'll pop in. It's, one of the things that we've been looking at too is those, like Tina said, those tools in the toolbox, but your base foundational coping skills, and you're running out of gas there, you're running out of juice on not knowing or seeing how long this may continue. So sort of finding out what else works for you. So one of the terms that comes to mind for me is what's called distress tolerance. And so how do you tolerate that something that you cannot change? And what do we need to do for ourselves in order to tolerate that a bit better and for a little bit longer, without, you know, going down different roads of negative coping or negative behaviors. So distress tolerance, and part of that is understanding, having an awareness of where you are and where your anxieties or stress lies, and then looking at that and striving towards not just reducing, you know, symptoms, but then striving towards wellness and well-being, increasing those things that support that wellness as well as decreasing. So
great, thank you, Tricia.
Could I just add something really quickly to that? So, besides these great comments that were made, I think what really is draining people is the lack of connection. I think that there's been very little experience that we've all had that has required us to stretch ourselves so much through screens, and so working that and finding creative solutions. So I think one of the most interesting things that I've seen are people kind of finding interesting in new ways to connect with families, to having Zoom parties together, to you see things online where people are celebrating weddings together. I think everybody is trying to live their lives in ways that allows them to connect, and any way that we can do that creatively, I think, is going to help people feel less alone and less drained by this.
Yeah, absolutely. A couple more questions. We still have some time. And this one, and again, if you have a question specific to your own situation, please put your contact information so we can get back to you. This question it really hit home in particular in many ways. I didn't hear any data on active duty family members, especially when the service member is deployed. These families have it far different than veteran families do. I feel like as a spouse stuck at home with 3 young kids, trying to work my own job from home alone with no support has not been addressed by any organizations. I see a lot for veterans, but I don't even have assistance from my husband's unit since he deployed without his unit. I think that one big place we can send you to is Blue Star Families. I mean, this is exactly one of the big reasons why Blue Star Families exists. I know that there will be immediate support if you reach out. So whoever wrote that, please connect with Blue Star Families. And then the other one that also I wanted to share is similar. For those of us who live in civilian communities that do not have the resources to support children, what is available for us, reserve families 70 to 90 miles from nearest installation? Thoughts there? Go ahead, Rajiv.
Well, I would say that, as has been mentioned already, but I just want to make it very explicit, mental health has been at the forefront of telemedicine, in my opinion, and they had it down before this all happened. And so I think this is the one time that geography isn't a limiting factor. So if you do need, whether it's a therapist, a psychologist, or a psychiatrist, the mental health community had this down. In fact, one of the challenges, we're getting more consumers aware of it. So I actually think that that's a great starting point, that you don't need to be right next door, to a psychologist or to a mental health professional. If you have a computer, if you have internet access, which I know is a big if, and there's some places that are not, that don't have, and there's some communities that don't have access to the internet. But I do think that that is a great place to start, and that your geography shouldn't be a limiting factor. And I know Cohen serves members of the Reserve and National Guard. And if you just think it's getting overwhelming, as everyone has said already, just reach out for help. It may not be a diagnosable condition, you're likely to get skills that will be helpful for you when you seek mental health care.
Excellent point, Rajiv. Finally, just very quickly, does this situation put families in greater risk of domestic violence? And how can families or friends mitigate that risk when there isn't an ability to social distance? Steve, do you have any thoughts on that, or Tina? Sorry.
Yeah, so I'm happy to make a comment about that, and then I think through science, and so what we've been hearing and what's been reported is that there are increasing levels of domestic violence in communities, not just in the United States but around the world related to this. So it's a challenging situation. I think there are. Maybe Tina can speak more to the service part of it in terms of what's available, but what I would say is that what we really need to ensure is that there's communication between family members. We need to understand what the hotspots are. I mean, so we also need to distinguish families that are struggling and having difficulty and don't have a history of that kind of behavior, and provide them with the tools that might be available to better communicate, problem solve, understand their hotspots, and have skills for conflict resolution. For families where it's been an issue and trouble, I would encourage them to reach out to the services that are supportive to them. So Family Advocacy Program is a service that's specifically designed to help families where they're struggling with domestic violence or interpersonal conflict within the family. Tina, you may have some other thoughts as well.
No, well, I was just going to say thank you for wrapping that into the services. I just say from that point, I'm very grateful for the person that asked that question. It has definitely been something that our internal clinical team has brought to the forefront and has wanted to make sure that we had the tools and resources that were out there. I am going to speak just from a community approach on what I'm seeing happening here in San Diego, and I understand that's the community that I'm in. So I'm going to say apply this to where you're at, understanding as well that our rural families have a different story. I appreciate that too. But the coalitions and collaboratives here, you really do have to look at your community on some of this stuff. Please do not stay blinded just in your military community. I know there are reasons as to why sometimes families even feel limited on that. So I can say from what I've seen here, there's a coalition around policy that is addressing this. Look for that if you need it. There are resources that are out there. People are paying attention to this. You just may not be hearing it in the particular military community. And that I think is important to note. So look to your community as well.
Thank you, Tina. Really, yeah, I want to give, we have 1 minute left. So I want to give every panelist 15 seconds to say a wrapped up thing. And you have 15 seconds and that's it. Steve, did you want to start?
I will just comment on that last point and just use my 15 seconds just to simply say, I think it's really important for families to identify their concerns before an event takes place. So the degree to which a family can identify that they're struggling and seeking out help is really, really helpful to them. It's going to make it's going to make them feel more comfortable reaching out and getting help before an event takes place that is more problematic for them. So I would highly encourage that. Seek services early.
Thank you, Steve. Trisha, 15 seconds.
Dang. I'm going to focus on well-being and wellness, emotional wellness and well-being, physical health and wellness, well-being, financial wellness, and just trying to focus back into those areas, building off skills that you already have or finding resources that you can continue to build more.
Beautiful. Thank you. Tina?
Mine's real quick. Stay in touch with this COVID initiative. They're doing a great job hearing your voices, so stay connected.
Awesome. Thank you. Rajiv?
Mine is to the organizations that are serving military affiliated populations and veterans. Bob Woodruff Foundation has a new call for a new cycle, grant cycle. It ends next week. It's COVID related. If you are out there and you want to help veterans and military service members, please look at our website and see if there's funding for you to do the help and do the work, as Tricia said, that you're already doing, that you're strong at doing.
Fantastic. Thank you. And before I throw it back to Kathy, I just want to say we're here for you. We're all in this together. There is hope. We are going to get through it together. And we're really happy that we were able to talk about this today. Kathy?
Thank you so much, Caitlin, and thank you to the whole panel. What a fantastic panel. I know everyone's applauding. So much great information. I think just boiling down the few takeaways, mental health challenges are real and they're a normal and natural part of this challenge. We have to take care of ourselves in order to take care of our families. We have to take care of ourselves. There is help. We heard it from everyone on this panel. Cohen Veteran Network, Blue Star Families, Hope for the Warriors, Psych Armor Institute, Bob Woodruff Foundation has a lot of great information. Uniform services, uniform health, uniform hospitals are also really excellent. I want to remind people too, Military One Source has free confidential counselors. So go to Military One Source for counseling and other help. Thank you to Holly and Millie for kicking us off. And now I'd just like to throw it over to Matt for some final comments.
Thanks, Kathy, and thank you to all the panelists. This was a really great discussion. So thank you for all that relevant information. And I want to echo Kathy and just say this was amazing. And people, please feel free to reach out for more info and connections. I want to remind everyone attending today to please check your email following this town hall. You will all be receiving follow-up information regarding this discussion, including a post-webinar survey. Please take a moment to take that survey. Your input is absolutely necessary to ensure that we are doing the best job we can for everyone. As a reminder, a link to the pain points poll will also be provided in that email. Please share that with your networks so we can get a really good picture of the different types of issues that are out there. Finally, I want to invite everyone to join us on next Tuesday, April 28th at 3 p.m. for a discussion on self-care and resiliency. We'll be joined by the Defense Health Agency, Tragedy Assistance Program for Survivors, and the American Red Cross to discuss important military family health concerns that have arisen during this crisis. And as a nice complement to that, I also invite you to join us next Thursday, April 30th, for a briefing on innovative installation community medical partnerships. You will hear on-the-ground reports about how bases are partnering with their communities to deliver innovative and needed medical services. In the meantime, be sure to check out our new website, full of resources that we've talked about that can help you, your family, and your business during this difficult time. Thanks again, and we look forward to welcoming you to a future webinar.